Good morning, people. What is schizoaffective disorder? Schizo refers to being on the schizophrenic spectrum. Affective disorders are what is used in psychology to refer to emotional disorders like bipolar or depression. And schizo disorders like schizophrenia are cognitive or thinking disorders. And so schizoaffective is some combination of schizophrenic symptoms and bipolar or depression in the same individual. They argue whether it's a separate disorder, whether it's a version of a mood disorder or a version of schizophrenia. Typically, you can kind of think of it on a spectrum, bipolar depression being the least that involves psychosis. If you get severely depressed or severely manic and bipolar, you can have depression or psychosis. It's schizoaffective. You kind of have a greater degree of psychosis along with a mood disorder. And then schizophrenia is predominated by psychosis. So schizoaffective is depression. We know what depression is, being abnormally down for a long period of time. Bipolar has depressive episodes. It also has, this is normal, hypomania, which you are just appearing to do excellent, but you're not really doing excellent. You are doing too excellently. Most people think that they're just at the best of their game when they're hypomanic, and others may as well, but really they're not doing well. They start to lose sleep, they start to take risks, and all the other symptoms that come with mania, being really speeded up in thinking and in speech, overly confident, etc. And this can ramp up to full-blown mania. And at the peak of mania, you can have psychosis. If you're just bipolar or depressive with psychosis, the psychosis is mood congruent, which means that it typically matches the mood state that you're in. If you are manic, you may think you're a king or a movie star or famous, godlike, etc. If you're depressed, you may think that you've already died or that there's a conspiracy against you. Negative thinking with a negative mood experience. Schizotypal, schizoaffective. Schizotypal is a personality disorder. Schizoaffective means that you have the psychosis separate from a mood episode. Your diagnosis may change over time because of this. They may diagnose you initially as depressed or bipolar or just schizophrenic, and then they notice that you have both issues going on because, say, you have a depressive or bipolar episode, mania, and no psychosis. Then later, without having an episode of mania or bipolar in a neutral mood, you have a psychotic episode that is diagnosably schizophrenic, but you have the history of the mood disorder. You may be diagnosed as schizoaffective. Schizophrenics can become depressed due to their condition, but that's secondary to their condition. So people with bipolar disorder or severe depression can become psychotic and not be schizoaffective. People with schizophrenia, predominantly psychotic and cognitive issues, can become emotionally depressed, but it's due to circumstances of their illness. And schizoaffective is a combination disorder of both of these things. My diagnosis personally has flip-flopped back and forth between bipolar 1 with psychosis and schizoaffective. That's why we're getting into this video, and I'm trying to break it down the best I can. Medication is different. Schizophrenia is typically antipsychotic. You have to be on antipsychotic. Schizoaffective is antipsychotic plus a mood medication, an antidepressant, or a mood stabilizer, depending on what your mood issue is. Bipolar is typically a mood stabilizer, depression, and antidepressant, And only when and if you should become psychotic as a periodic light treatment as necessary due to the episode of psychosis, you are on a brief term of antipsychotics if they're needed. And all of these things come with behavioral therapy. Good morning, goodbye. I'm running out of tape. So that's what you get. That's what schizoaffective is. And the difference between bipolar schizophrenia and schizoaffective in a nutshell. Bye, YouTube.